Good afternoon, my name is Michelle and I will be performing a head-to-toe physical assessment on you today. Prior to this, we have checked your vitals, which are within normal limits, and we have also collected a health history on you. If you can, could you please tell me your name and date of birth?
Antonio Lopez, June 13, 1987.
Okay, and where are we currently located?
New Jersey.
Good, and what is today's date?
July 8th, 2020.
Okay, very good. And who is the President of the United States today?
Donald Trump.
Okay, so according to that assessment, you're alert-oriented ×3. Your cognitive abilities are intact. Your thought process is logical, and you have clear speech and appropriate vocabulary. I'm also assessing that your posture is erect. You look relaxed. Your mood is appropriate. You are also dressed appropriate for the season, and you look well nourished. Throughout this exam, we're going to be assessing your skin turgor, your skin temperature, checking for the color of your skin, as well as for any swelling or lesions or anything that would stand out. First, I'm going to start by assessing your head and face. Okay, I'm going to palpate your scalp here, and I'm noting for any lesions or any dandruff or any nits, and I'm noticing that your hair is fine and evenly distributed. There are no signs of hair loss noted. You can put your hat on if you like. Your facial expressions are normal. Your facial is symmetric. And now I'm going to ask you to smile. Okay. Puff out your cheeks, frown, raise your eyebrows, close your eyes tightly. Okay, very good. And then I'm also going to check for the sensation. If you can close your eyes and let me know if you feel a sharp or dull sensation. Okay?
Dull. 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 Sharp. Dull. Sharp.
Okay, very good. So cranial nerve 5 and 7 are intact. Now I'm going to palpate your temporal arteries for tenderness and elasticity. Okay, now your temporal mandibular joint, if you can clench your jaw. Okay, open your mouth and move your jaw from left to right. Okay, it's movable and there is no tenderness that is noted. So we're going to start by assessing your eyes. If you can stand for me, I'll have you take a look at the Snellen chart here and read the lowest line that you can read.
LTFPH.
Okay, now close one eye. Read with the lowest line you can read.
LTFPH.
Okay, and we would do that with the other eye as well. Okay, great. Your vision is 20/20. You can have a seat. Now I will have you cover your right eye. I'm also going to cover my right eye, and you're going to let me know when you see my hands come into view.
No. No. No.
Okay, keep that eye covered.
No. No. No.
Okay, very good. I'm going to check you can uncover your eye. I'm going to check if you can follow my finger without moving your head. Okay? And this is checking for your extraocular movements. Okay? If you can just take a look here, I will shine a light in your eyes. Checking on your pupils, very good. Okay, so check here, and Let's pay attention to my light now. Okay, very good. So your pupils are equal, round, and reactive to light with accommodation. And this also shows that cranial nerves 2, 3, 4, and 6 are intact. Okay, now we're going to take a closer look inside of your eye with my ophthalmoscope. But before I do that, I did want to make a comment that externally your eyes do not show any abnormalities. There is not any discharge. If you can look here, your sclera is white. Just going to pull down your lids here. And your conjunctiva is clear. Okay? So I'll use my ophthalmoscope. Okay, I'm going to find the red reflex. Okay, I found the reflex. Very good. And now I'm checking your fundus backgrounds, checking for any abnormalities. I'm also assessing your optic disc and your vessels and your macula at this time, and I do not see any abnormalities. Very good. Okay, so now we're going to move on and I will be assessing your nose, and from here I can see that your nose is symmetrical. I'm going to take my pen light here. I'm going to have you tilt your head back a little bit. I'm checking your turbinates, and your nasal mucosa is pink, moist. Your septum is not deviated. Very good. If you can close one nostril for me and breathe in and out. Okay, do the other side. Okay, very good, and it shows patency. Now I'm going to have you close your eyes, and I'm going to bring you a container and let me know what you smell.
Pepper.
Yes, very good. Okay, so that proves that cranial nerve 1 is intact. Now I'm going to assess your sinuses, so I'm going to palpate here for your frontal sinus. Okay. Is there any tenderness?
No.
Okay, maxillary sinus. Any tenderness?
No.
Okay, very good. So we're going to move on to the assessment of your mouth. I can see that your lips are moist, they are pink. If you can open your mouth for me like this. Okay, your teeth are clean and aligned. And open your mouth further. Okay, very good. And I can see your buccal mucosa is pink, smooth. There is no exudate. I'm gonna have you say ah. Okay, and your tonsils are 1+, and I'm going to assess. Say ah one more time. Okay, and your gag reflex is intact as well. Okay, so now I'll have you stick out your tongue. Okay, very good. And then put your tongue back in your mouth, and then you're going to push your cheek up against your, push your tongue up against your cheek. Okay, very good. Try to push my hand. Very good, so your tongue strength is intact. This mouth assessment has shown that cranial nerves 9, 10, and 12 are intact. So we're going to move on and we're going to now assess your ear. I'm going to be checking externally that the color is even. I can also note that there are no lesions or no abnormalities or drainage. All right, I'm going to use my otoscope. Okay, I'm going to pull your pinna up and back, and I'm going to assess that your tympanic membrane is pearly gray and intact. Your ear canal is free from any cerumen, and the cone of light is non-displaced. Very good. We're also going to check for your hearing acuity. So I'm going to whisper 3 words and then I'll have you repeat them.
Red, green, blue.
Okay, very good. We're also going to perform the Weber test on you. So I'll ask you to remove your hat. I'm going to ask you if you hear the vibration in both ears equally.
Yes.
Okay, now I'm going to conduct the Rhine test, and this is going to test for air conduction and bone conduction. I'm going to place this behind your ear on the mastoid bone, and you just let me know when you no longer hear the vibration.
No more.
Okay, do you still hear?
Slightly.
No.
Gone.
Okay, so your air conduction is greater than the bone conduction, which is a normal finding. This also shows that cranial nerve number 8 is intact. Okay, we're gonna move on and I'm going to assess your neck now. So if you can, please tilt your chin towards your chest. Okay, very good. Tilt your head back. Okay, very good. Turn your head left and right. Okay, and now tilt your head to your shoulders. Very good. And this shows that your range of motion is intact. Okay, I'm also going to have you push up against my hand. Okay, same thing on this side. Okay, and shrug your shoulders. Okay, very good. So cranial nerve